Hi, MidState fam. Hope you guys are doing good today. We just wanted to pop on here and give you guys some pointers on how to take care of your skin, especially towards teens or acne prone skin, things like that. So I'm going to do a really quick video. It's going to be very simple. We're going to cover how to wash your face, what to wash your face with, and then Colby's going to jump on here and go over some products that she could prescribe that help with inflamed acne, cystic acne, and blackheads as well. So I'm going to go over some things that I can do for you guys, and some things that she can do, and things that you can do at home as well. So the first thing is we want to start with a good cleanser, and we want to do this twice a day. We want to double cleanse. So you're going to cleanse your face in the morning. This is my favorite tool. Everybody always asks me if you need a Clarisonic or if you need, these tools to kind of wash your face with. And I don't really necessarily think those are the best thing to do, especially if you have inflamed acne and things like that. It can sometimes make it worse. So we want to be a little bit more simple than you think you should be with your acne. So these are bamboo and charcoal cloths, and they are super, super, super soft. So they're very easy to use on your skin. So I use one of these every night, and you can get a pack of these on Amazon for really cheap. So you could actually have one for every day. And what you would do is you would get your hands a little damp, put your cleanser in your hands, and you're going to do circular motions, and you're going to work really, really good in this area, because this is kind of your T-zone right in here and right on your chin. Those are the areas that we tend to get blackheads, breakouts, things like that. So you want to really, really work that cleanser in, and you want to do circular motions. When you think you're done cleansing, you want to keep going another 30 seconds. You want to at least do about a minute and a half to cleanse, and then rinse your hands back off, wet your towel, and then remove the cleanser. Rinse this again, remove it again. If you wear makeup, you want to do that twice, because we want to remove the makeup either with a oil cleanser or double cleanse with our regular cleanser. So we definitely want to remove the makeup, and then we want to cleanse the skin again. Then we're going to do a moisturizer. An oil-free moisturizer is great. We have some here in our office that are great. We have some ones that we recommend at the drugstore, things like that. So if you have questions on that, maybe come in and get an express facial where we do some extractions and things, or dermal infusion where we suck all the blackheads and dead skin and bacteria and everything out of your skin. And then you can see in the jar, what we got out. So that's a really awesome treatment for any kind of acne, which is great. So we can talk about, skincare at that point too, as well, if you're, kind of wanting to get a skincare regimen at home. And then we're going to obviously put SPF on in the morning time with an oil-free moisturizer. And then at nighttime, we're going to use either topicals that Colby's going to recommend or one of our providers will recommend. I can recommend a couple things, that you can use at home as well, but it's a very personalized, skincare regimen for you. So if you're not really sure, what you need to be doing, book an appointment with me or book an appointment with one of the providers, and we'll definitely get you on a good regimen to take care of your skin. And, if you're in doubt of what you need to be using and how you need to be using it, just kind of simplify everything. Start with a good cleanser and a good morning moisturizer with SPF, and a good nighttime moisturizer that is specifically for nighttime, because we don't need SPF when we're sleeping. And, that's a good place to start. You don't need to do anything crazy, and then we can always add things to your regimen depending on what your skin needs. The other thing is, number one, you do not need to be touching your face ever during the day unless you are cleansing your face or putting your moisturizer on. You have oils, dirt, grime, oil, just all kind of things that you don't need to be putting in your pores. It just makes it really, really congested. If you have active acne, inflammatory acne, you're gonna, if you touch this place and you're picking and then you touch the other place, you're actually moving that bacteria over here. You're gonna cause breakouts over here as well. So we want to stay away from touching our face. I taught myself a long time ago, it's a no-no unless you're cleansing or moisturizing. The other pointer I love to tell especially my teens or anybody who's really active outside, you want to keep some wipes. We prefer micellar wipes. Simple is a good brand to get those from. Micellar wipes are very, very gentle on the skin. They don't have any additives to them. And just, make sure you're wiping all that sweat off right after your sports. And so as soon as you get home, then you're going to cleanse your skin or wash your face in the shower and then put your moisturizer on as soon as you get home. But that'll kind of keep those pores clean of all of that sweat and dirt and grime and things like that when you're working out or doing your sports. The other thing we like to tell our patients is to change your pillowcase every other day, even every day if you have extra pillowcases. I tell people to just go out, purchase some extra pillowcases. You don't have to change your whole sheet set, but as we're sleeping, and I know a lot of people kind of sleep on both sides of their face, they go back and forth, and dirt, oil, grime, everything from the environment can kind of land on your pillowcase, and that can congest the skin as well. So we want to help that from, or keep that from congestion in our skin. So you want to kind of change your pillowcase a lot more often than you do all of your sheets. Let me see. I always have notes, you guys. I always forget. The other thing would be when I get home every day and I do my clients, I'm done with my clients, I have my dinner, and I know I'm not going to go anywhere else. I go ahead and do my skincare. I go ahead and cleanse my face, do all my skincare that I do at night, and that way it's done. I'm not waiting right before I go to bed and then I'm tired, I don't feel like doing it, or I forget or something like that. Once you get in the habit of doing that, it'll make it much easier for you to take care of your skin. So as soon as you're done, you're home, you've eaten dinner, you're just going to sit and watch some TV, go do your skincare, go do that regimen real quick before you get, kind of tired and relaxed and all that. And then it'll be done. Then you can brush your teeth and go to bed when it's time to go to bed. So, I hope these things helped you guys. I know it was a really kind of simple, short video. But I want to introduce Colby. She's going to jump on here and, kind of go over some skincare products and some medication, some topicals, internal medicine as well, to kind of help different types of acne that we treat here at MidState. So we'll see you guys soon. Have a great day.
Hi, I'm Colby Beck. I'm a physician assistant here at MidState Skin Institute, and I'm going to talk to you guys a little bit about acne and things that we can do to help. Primarily, we're going to talk about teenagers and acne in early adulthood. There is many treatment options available for acne these days, and primarily for my teenagers, I try to keep it very simple and a very easy to follow skincare regimen, because if you make it too complicated, then typically the teenager is not going to do it, or even adults are not going to want to have 5 steps to be able to put on, because they just will likely choose 1 or 2. First and foremost, treatment options available would be topicals. We can always start with topicals such as topical antibiotics, topical retinoids to help decrease your oil production, dry out your skin, increase cell turnover. It also helps with scarring a little bit. Then if topicals aren't working, we can always go into more oral therapy where oral antibiotics, spironolactone and Accutane come into the mix. Oral antibiotics, primarily we use ones called doxycycline or minocycline. Doxycycline more so will help decrease inflammation as well as bacteria. For spironolactone, that is more for this jawline acne, and it's where we usually treat it for people who have more mature skin or adult onset acne. And then Accutane. Accutane is a great medication. It is used as a systemic therapy that you're on Accutane for about 6 months. It's the only thing that we can really guarantee your acne will get better on, but we just can't guarantee that it will completely cure it. But it's a great therapy. There's a lot of treatment options available for kids and acne. So if you are experiencing acne, feel free to call us and make an appointment.
Okay.